I recently spent time in an emergency department for one of my nursing clinicals, and I found this to be an incredibly valuable experience, not only for my transition into professional practice, but also it helped me gain knowledge about some social justice issues within our healthcare system. I initially went into the emergency department thinking that it was going to be all blood and gore and backwards limbs, but it was just not the case. A lot of the times it was patients that could have received care in outpatient settings. A lot of patients were on Medicaid, which is a system that you have to apply for annually. And this system provides insurance which covers health expenses for many patients who are either below a certain income level or have disabilities. The thing about Medicaid is when they ask a provider whether they could be one of their patients, many providers actually deny this care because they find that Medicaid pays at lower rates than other insurance. This can lead patients to have to spend hours waiting in a waiting room for the emergency department when they could have just gone to see their primary care provider at an outpatient facility. This may dissuade patients from receiving the care that they need. And this is just very bad as a society for health. And it contributes to the major health disparities within the United States healthcare system. In addition, I've found that many healthcare workers do not adjust the care they are giving to many patients who require individualized care. For instance, many patients come into the emergency department or all areas of the hospital who are homeless or have low income or have a low health literacy, which is the ability to comprehend the educational health education that we give to these patients on preventative measures and taking care of themselves following their hospital visit. For instance, one of the patients that I had was a patient who a week ago had a toe amputation. He was a homeless individual. He showed up for foot pain, and we admitted him on a bed. So we pulled his sock off and found that his toe was completely red, or what was left of his toe after the amputation was completely red, it was warm, and it was oozing pus. This was a clear sign of a pretty bad infection. And as we kept on talking to him, he was like I said, a homeless individual with difficulty speaking English as it was his second language. He explained to us that a week ago after the amputation, he was admitted onto a unit and his healthcare team had promised that he would receive a boot. And when he did not receive this boot after a day, he became frustrated as he didn't really understand any other material. He thought the boot was going to be the solution to his entire problem. His healthcare team did not keep him updated or properly educate him at his health literacy level to receive the care and the education that he needed for his own beliefs and mental stability. So my patient became frustrated and actually left the hospital. He explained that the nurses didn't really stop him either. The nurses aren't allowed to stop him, but the nurses should be providing education on why it's important for him to stay, as his diagnosis was pretty severe at that point. They let him walk, and they documented in the chart that he was AMA, which means against medical advice. This patient was left to the streets without education on follow-up appointments, how to get to these follow-up appointments since he was homeless, or how to care for his toe on his own. He was left with nothing, and he's lucky that he showed up to the emergency room because his toe was infected. God forbid he stayed out longer and that toe infection, localized toe infection, became a system-wide infection that can lead to fatal outcomes. It's really important for nurses and other healthcare workers to adapt their care and provide high-quality care and individualized care to these patients and help them through education and collaboratively work with them to plan their care as a whole. It doesn't matter who patients are. I once had a clinical professor say that patients walk in with an invisible bag and you don't know what's in it. That's so true in a hospital because everyone's very different. There's a lot of problems with the American healthcare system, but one thing that nurses and other healthcare workers can do right now is provide high quality individualized care to these patients. For long-term goals, it'd be great if there was a policy put in place for providers being forced to take on Medicaid patients and provide the same quality of care that they would provide to any other patient. These people need care in outpatient facilities just as much as everyone else does.